Thank y'all so much for joining us tonight. We are so blessed that you decided to spend 30 minutes of your Monday evening with us. We just know that there's lots of things you could be doing tonight, and we just appreciate you taking time out to join us. My name is Nikki McCutchen. I will be your host for this evening. We are going to get started with our medical disclaimer. Tonight, what we will be sharing is for informational purposes only. So all Lifeway products are not intended to treat, cure, diagnose any illnesses or diseases. And so we always recommend that you check with your physician first, and just make sure that you're doing everything that you need to be doing to make your health the best it possibly can be. And so if you're pregnant or nursing, we also recommend that you check with your physician as well. So thank you all so much for being here tonight with us. Like I said before, the call will be for 30 minutes. What we're going to be discussing is this amazing little patch technology with LifeWave. This is called X39. So the patch is completely non-transdermal. There is nothing that transfers from the patch into your body. So it's completely sealed on both sides. That is very important because most people, what you're used to is a transdermal patch, meaning something transfers from the patch into your body. A nicotine patch, an estrogen patch, a vitamin patch, those all transfer something into your body. This does not do that. It is completely sealed on both sides. Uh, if you were to look through night vision goggles, like what you see on the movies, and you see that heat signature, people will call it a heat signature when they're looking through night vision goggles. And that heat signature is actually a low-grade infrared light that all of our bodies emit every single place in our body. And so that infrared light is actually reflected back from this amazing little patch. Show it to you again. From this patch, it's a reflective crystal lattice structure that is inside of there. And it reflects your own infrared light back into your body at a certain frequency. This may sound very unusual, especially if you've never heard of anything like this before, but you all actually are very used to this kind of thing going on in your body through the sun, through a process called photobiomodulation or phototherapy. That big word just means light making change in the body. When you go out into the sun and the sun hits your eyes and your skin, it causes your body to activate the vitamin D that's already inside your body to do what it was designed to do. And so then it activates at the cellular level to be able to receive nutrients into every cell in your body. And so the sun is so very important for that. But this process is something that David Schmidt, our founder and inventor, studied and was able to then put in this tiny little patch, like a little Band-Aid that we just have to put on our skin, and then it is able to reflect that infrared light that we emit. That crystal lattice structure is made up of amino acids, crystals, sugar, water, salt, all at the stereoisomer level. So molecular level, tiny, but a reflective structure. So it's not things that you can go get out of your pantry and put on your body, nothing like that. So stereoisomers, the molecular level is what we're talking about. We do have clinically tested spots. We have over 90 clinical studies, over 150 patents, and we can get you access to all of those. But actually, because this technology has been around for over 20 years, you can place it anywhere on your body because that infrared light comes out of your body at every place. And so you can put it anywhere that you need to. So if you have a pain or if you have an issue, you can just put the patch right on that spot. We can't actually direct it to go to that spot, but sometimes it's very interesting because it can influence whatever's going on at that spot sometimes and reduce pain and reduce inflammation. And so we always I tell people, if you need to, then you pop the spot with a lot. use as many patches as you need to help get whatever's going on with you, to help try to get that issue to be benefited and influenced. The recommendation is that you wear the product for 12 hours on, 12 hours off. So 12 hours on to activate and repair, and 12 hours off to let your body rest. What happens anytime you use any type of light product, so any kind of cold therapy, blue light or red light therapy, your body can attenuate to it, and all that means is it just gets used to the light, and so your body stops reacting to the stimulation. And so that's why we recommend for 12 hours. That's what's been clinically tested and proven, that it will react and do what it needs to do in that 12 hours, and then you need to take the break. The other recommendation that we have for you is 1 month for every decade you are old. So if you are 50, then you want to wear this for 5 months to really give your body a chance to be able to get things up and going and active that have been dormant for a while. Because this is completely natural, the expectation is not that you are going to see results immediately. That does happen for some people, and I'm telling you what, we are all praising the Lord and clapping our hands and so excited that it does. But sometimes that's not the case for people. And so we never want to give anyone an idea that this would happen really quickly, because our body, if we've been in a certain state for a long time, it's going to take us a while for our body to start working the way that it was designed again. The body wants to heal. We were designed to heal and regenerate. And so when we support the body the way that it was designed, then it can start to do what it needs to do. But a lot of times there's a lot of junk that needs to get cleaned out and fixed up before you can start noticing anything. And so we always want to make sure that everyone knows that this could take some time. And so you just need to commit to a minimum of 1 decade for every year you are old, to give your body a shot, a chance at seeing what it can do to regenerate itself. And we have this amazing body, and so it is just so wonderful to watch it work the way that God designed it to. The peptide that's getting activated when you utilize this technology is called GHKCU, or GHK copper peptide. And so what that peptide does is all of these amazing things in our body. If you go to the website, and maybe I'll bring it up here later, I don't want to screw up what I what I have set to bring in a little bit, but reverse aging with GHK.com. This was all the original research done by Lauren Picard over 50 years ago, and all of the things that this peptide does. And there's some amazing things that are listed on that website. But just to give you a few ideas, one of the things that it activates is your dormant stem cells. So stem cells in our body, every cell in our body was once a stem cell. That's how our whole entire body was created. And so GHKCU activates pluripotent stem cells, which mean those stem cells can go to any area and regenerate and help an area do what it was designed to do. And so people will have all kinds of interesting things that happen where one person will have a certain issue that they're wanting help with, and then someone else will have something completely different. And they will be helped by both, because that's what stem cells do. And ultimately, your body gets to decide, which is one of the reasons I love this technology so much, because it just helps our body work the way that it was already designed. Another thing that it does is that it helps to support the cardiovascular system, every part of your cardiovascular system. So down to even the lining of your blood vessels, your heart. So people will notice things happening positively with their blood pressure or their heart. For every 6 months that you utilize the technology, this helps to reverse what's going on at the vascular level by 8 years. So the molecular level of your blood vessels by 8 years. I mean, that is just shocking. So this is one of the studies that we have. 14 out of the 15 people reverse their vascular their vascular health by 8 years, every 6 months. So even if you are 50 and you're just going for, you're just trying to see what it's going to do for 5 months. I don't know about you, but I want to wear it 6 months and 6 months again and 6 months again, because I want to continue to reverse my vascular age by 8 years as much as my body can possibly do that, just to help to reset me to a younger, healthier state. And another thing that it does is wound healing. This is the picture that I will bring up. It's on my own body. So if you have surgery of any kind, um, this rebuilds scar tissue, it remodels scar tissue. And so I'm going to go ahead and screen share this so that you can see. But I do want to tell you, so what works with that as well is collagen. So this copper peptide also helps collagen from the base. So a lot of people are taking collagen to help with their hair, skin, and nails, and that's what most people think of. But we need collagen in our bodies for every part of our body to process, to work properly. And our skin is so important. And so anytime we have an injury or we need to have a surgery, that damages that skin. And so when you support the collagen from the base, then it allows your skin and that scar tissue to completely remodel. So I'm going to show you this. I had, I'm going to screen share. I tore my Achilles. It's been a little over a year now. And so you can see when I first had the surgery, this was, a little bit after the surgery, because it was already, I think they had taken oh, what am I thinking of? The stitching or whatever, they took it out. So you can see even at 2 weeks, how much it was already repairing. At 4 weeks, you just see this little line. And at 6 weeks, it's really hard to tell. And really right now on my leg, for you to be able to even see it, the sun has to hit it just right for you just to see the cut mark of where, they made the incision to repair my Achilles. So this remodeling of scar tissue is huge. Now, I will tell you that, of course, I did not, I used a lot of the patches. I would use 3X39, 3 Eon, and 3 Carnosine. So that my body would have as much support as I possibly could have. But I also, even still now, I use cupping, as well as I use castor oil. I do go ahead and scrape it to try to break that scar tissue up. So there's still lots of other things that we need to utilize with this technology to cause our body to work at optimal levels. And so the really cool thing about when I had that injury was as soon as I tore that, I came home, I put extra patches on there. You could just barely kind of start seeing that dark bruising come up. And as soon as I got those patches on, that bruising immediately started to dissipate. I really didn't have any pain. There was really no pain. There was no swelling and no bruising. And then after I had the surgery, obviously, I had some pain. I did utilize some pain medication for like the first day, and then I just used the patches. But again, the crazy thing is that all that bruising completely went to the yellow stage, and it wasn't as like I would have thought the whole base of my leg would have been yellow. And it was really just very minimal around the scar, when it gets into that healing stage where it's more yellow. So I just didn't even really have any bruising from that, and no swelling. And after I got through those first few days, just no pain. Whenever someone has some type of surgery they have to go through, I cannot recommend more highly the importance of patching for prevention. So, obviously we're never planning on having anything like that happen, but the fact that we can help our stem cells to get going and have more active in our body. So if something does happen, the amount of help that we're going to have from that is ginormous. And then even just through everything that's going on, and you can see, and mine is not unusual. This is not unusual. I have seen just probably thousands of pictures of people with different surgeries like this, that their scars will heal like this. I have a friend who she'd had a surgery several months before she started patching, and it was crazy because within it, and I could still kind of see, it was on her shoulder. I could kind of see the scar. I'm hoping she's going to do a testimonial with me in a few weeks, but it was just really pink, like she just kind of, pretty pink still there. Within a week, I was shocked because that went away so fast, even though she had not been using patches. And it was just amazing to me that now, I mean, you would never even know that she had shoulder surgery. I mean, I'm standing out in the sun with her and you can't even tell. There is literally nothing on her shoulder. It's just so amazing. So the wound healing and the collagen that benefits in situations like that is so very important. And another thing that the GHKCU influences is the immune system. So I was just talking to a gal today, and she was saying how she was feeling something coming on, but she'd been utilizing the patches for a couple months now, and the allergy reaction that she normally would have had, it did not get near as bad as what she expected. And then, she, said that she was, kind of didn't feel quite right here lately. And I said, well, maybe your body's just trying to fight something off. And, nothing's going to come of it, but you can just kind of feel it and your body's doing what it was designed to do. So to have that support from our immune system like that, especially as we age, is so important. Another interesting thing about our stem cells is that they go dormant. By the time we're 30, over half of our stem cells go dormant. By the time we're 60, we only have 10% of our stem cells active. And so the longer you utilize this technology, it has a compounding effect. And so more and more stem cells will get up and regenerating to help reset your body to a younger, healthier state. I know people who talk about how they've had their biologic age tested. A gal who's 50 and her biologic age says that she's 25. And so when we're telling you that this technology, this is what it does, we have results from that. And so you can be sure that it is going to do something very positive and very, very beneficial in your own body as well. Another consideration that you want to think about when you utilize this technology is hydration. Drinking enough water is so very important. Half your body weight in ounces is what we recommend. And when you're using the patches, usually you need more hydration. If you work out, if you sit in a sauna, you're going to need more hydration. So hydration isn't just water, but it's also electrolytes. And so getting those electrolytes in is also very key. Sodium, magnesium, potassium, to help your cells be able to receive and move the information that it needs so that they have what they need so that they can do that regenerative process. Oh, I forgot one other really interesting fact that I wanted to mention. The New England Journal of Medicine, I just heard this the other day, published an article that said the number one influence to someone's wellness is the amount of stem cells that they have in their blood. And so if we can figure out, which we have with this technology, to help our stem cells get up and get moving, then we have given ourselves a huge gift in being able to do all the things that we want to do throughout our life. And not, I listened to another doctor, he always says, when I grow old, I don't want to meet a new person every 10 minutes in my house. And I agree with him. I do not want to meet a new person every 10 minutes in my house either. I want to be able to live my life to the fullest, to enjoy playing sports with my kids and my grandkids someday. And I just want to be able to have every day just be a joy and feel well and have wellness. So that is our amazing X39 product. I would love it. If any of you have any questions, I would be happy to answer those. You can put them in the chat. You can raise your hand. If anybody has a story of someone that they've helped or something that's happened with their body, I would love to hear that as well. So you could also just unmute yourself and start talking. So I would love to hear from you. So who would like to come on first? Liana, yes, please share.
Okay. I've got two friends because specifically two friends who are using the X39. They've been on them one approximately 6 months, one approximately a year. And both of them normally have horrific allergy symptoms. And both of them have gone through this allergy season with virtually no symptoms. And neither of them can believe what's going on. And they know it's the patches because that's the only thing they've done different. And they're just ecstatic about that. And my one friend went to the eye doctor. She's in her early 70s and went to the eye doctor and was very pleased to get the report. I don't need to see you for another 2 years. Your eyes are fantastic. And she knows it's only the patches. So she's just rejoicing.
That is amazing. And so how long has she been wearing them?
She's been on the patches about a year.
A year. Okay. That is, and just X39 or anything else?
Yeah, she's using just the X39.
Okay. That is amazing. You said 78.
What,
She's
her
70.
age?
Yeah.
No, in her early 70s. I think she's 74.
Okay. That is just, can you imagine at 74 going to the eye doctor and having them tell you that you don't have to come back for 2 years? Like,
That's
I
pretty
think my
amazing.
jaw would hit the floor. Like, yes, that is so great. Oh my goodness. I love that. And anybody that suffers with allergies, oh my goodness, because usually that's like been going on for years.
Yeah.
So to be able to go through a season and be shocked that you're not having any allergies, that is so worth it. I mean, there's so many people that do injections and do pellets and do all kinds of things for the allergies. So being able to have a technology that all we have to do is put it on, just put it on your body, and your body gets to decide, so having something as, scar tissue to people with allergies. I patched a gal the other day that has an autoimmune condition that causes pain throughout her whole body. And she just immediately was out of pain, using the X39, the Eon, and the Ice Wave, was able to just shocked. I mean, she's had this pain for years. So anytime you can combine, especially multiple modalities. She worked in a chiropractor's office. So obviously she's getting great treatment and great care in that way. But the need for combining modalities is so important. And so to have something like this that chiropractors could use, doctors could use, functional medicine doctors could use, health coaches could use, to help their patients, is just phenomenal, because they're giving their patients phenomenal care and advice. But then to have something else that will support everything else that they're doing is amazing. Anybody else? Yes.
Can I add? I know I think I told you this last week about my C-section scar. I'm just in awe, because it was literally like a rope across my lower abdomen and very dark. And now it's almost undetectable. And I just,
oh my goodness.
I just can't get over it. I just keep looking at it going, it's just amazing. It's just amazing.
Because that was how many years ago? 40 years ago?
Not quite, 32.
Yeah. I mean, like, that's a scar that's been there for 32 years.
Long time. Yeah.
I mean, for it to be completely gone, it's just, absolutely incredible. Yes, which is, again, the remodeling of the scar tissue that we were talking about. So, that's awesome.
Fantastic.
Yes. Anybody else have any questions or things you'd like to add? You can put them in the chat, or you can raise your hand. Trying to think of another story. I've patched so many people here lately. I should have another story, but someone who had sciatic pain. I went again, same thing, X39, Eon, and Ice Wave. Eon is our anti-inflammation patch, and then Ice Wave is our pain patch, which actually triggers beta oxidation in the body, but helps to break that pain frequency. And so using those 4 patches too interesting, because a lot of people's pain is different. Even if two people have sciatica, they might have to be patched completely different, which is what I did. And so, but was able to completely have one gal's pain go away and the other one significantly reduced. So that's also just, a huge miracle. And, I don't know that I've talked about this either. I have a friend who had herniated disc. And of course, they want her to have surgery. She don't want to have surgery, has been utilizing the X39 for over a year now. And her bulging disc is completely gone. It's not there anymore. So yeah. So again, it's your body gets to decide all of these unusual things that happens in our bodies, things that break down. But that GHK copper peptide does so many things. And especially with it activating the stem cells that people can have just amazing results. Oh, great.
Can I
Vicky's
ask you a
adding.
question?
Yes, please do.
Can you tell me how you patched the sciatica, both of them differently? How did you patch?
Yes. So the one was so she actually had 4 bulging discs along with the sciatic pain. And so I was having to try to help with the bulging discs along with the pain shooting down her leg. So I did put an Eon on the back of her neck on the C7. I placed, and so with her, I used 2 sets of ice wave. I placed, and actually, this is something that I have just recently started doing that has really helped. I just hold the ice wave on and I move it around so that I'm not, and I do carry extra tape with me, so I'm not actually sticking it to them, and I'm always doing it on the outside of the clothes. The Eon I normally just stick on, and then I'll do the ice wave. With her, it ended up being white on right, tan on left, but I would just hold it and move it. So the first time I did it with her, I went down her leg trying to find that, pain relief. And she did get some pain relief, but I was like, because you have these bulging discs, let me try white on right and tan on left. And so we did that. And then I added another set of ice wave down the side of her leg as well. And then we put the X39 in the center of her spine between the 2 ice wave. So and again, I just held them on there, and we knew that we got the pain reduced with that. And then I started to hold the other ice wave. So the second gal, again, Eon on the back of the neck at C7. And then I did the one where we've seen down the leg. So her pain started, kind of on the back of her bottom. And so we just held, I had her hold the patch there where that pain spot was. And then I went down that leg. So in the thigh, on the outside of the thigh. And so it was, down significantly from her bottom, but then I moved it a little bit because there's a certain pressure point there in your thigh, kind of along the IT band, that if you can find that spot, it can really relieve a lot of pain for someone. So I had started up a little bit higher, and then I thought, I think I'm a little bit high to where that pain point might be. And each time I do this, I have them take a drink of water. So I hold a patch there. I tell them to take a drink of water. I moved it a little bit more down her leg. I had her take a drink of water, and she was like, oh my goodness, like that. Like, she's like, I just feel like soreness now. It's not really pain anymore. And then I put the X39 on top of it, and she even got more relief. And then after that, I let them, go to the bathroom and put them on their actual skin. But it's great because, again, it's just proof that you don't have to be touching the body because it's completely non-transdermal. Okay, so Vicky's saying she patched someone with sciatica yesterday. He was at a 7 on the pain scale, and he couldn't believe the reduction of pain and discomfort with the Eon, the ice wave, and the X39, which is the exact same thing that I did. And her brother-in-law had frozen shoulder, and we they patched him, and he could move it and lift it without any pain. So with frozen shoulder, I've had this with people too. Like they usually can't like lift their arm maybe above, like this level. It's just like stuck, like they can't, there's so much pain. And like one gal that I patched, she couldn't even remember the last time that she was able to lift her arm above her head. I patched her and her arm just went straight up, which is what Vicky's saying too. He could move it and lift it. I mean, like they will reach behind their backs as well, because like there's only a certain place, like they can barely just get their arm behind their back. And like they're like reaching farther than they have ever reached in a really long time. So yes, so to be able to help someone with these types of pain issues, just such a gift and such a blessing for them, for sure. So thank you for sharing that with us, Vicki. I really appreciate it. We are actually over our time tonight. So thank you all so much for joining us. Again, just know that whoever invited you to this call really just cares about you, to want you to know about this technology. And so please get back with them. Ask them more questions. If they don't know the answers, there's several of us on here who can help you. Liana, Vicki, myself, they can get in touch with us so we can make sure that they get the answers that they need. Oh, let me stay on for just 1 second. So we have a question. Do you have any suggestions for plantar fasciitis? So that's another one that can be a little bit tricky sometimes for people, but I would say to use the ice wave on the bottoms of the feet, white on right, tan on left. Do the Eon on the back of the neck. So start with the Eon on the C7 back of the neck, drink some water. Place a white ice wave on the K1 spot on the bottom of your foot. If you look that up, you just online, it'll show you exactly where it is, K1. White on right, take another drink of water. Tan on left, take another drink of water. And then you may even like patch the X39 on the lower part of the spine is another good one. If there's still pain, you can add another set of ice waves. So white on right, tan on left at the tops of your shoulders here. So you can kind of see that on me, white on right, tan on left, to try to break that pain frequency. Every time taking a drink of water. Sometimes when you do white on right and tan on left, it can take like 20 minutes. So sometimes it takes a little bit longer because it's going through your entire body. The other thing is get back to the person who invited you. And let's make sure we get you. We have some different pain patching guides that we can send you. And sometimes you just have to keep trying different things because people's bodies are completely different. Another thing that I always recommend for people with plantar fasciitis, you can go on Amazon and like there's these sock things that like hold your foot when you sleep, kind of in this position that has this like thing, but you sleep in it. And I had plantar fasciitis for like 7 months one time, and I didn't have any of the traditional pain things that come with it for someone to say, this is like normal plantar fasciitis. And so I just held off on buying that thing. Well, I think it was like $30. I mean, something, and I should have just gotten it. Once I got it, within a month of sleeping in that every night, my plantar fasciitis finally went away. So that's always a really great thing to look into as well. But make sure we get help to whoever has plantar fasciitis and get you the answers that you need to have help with that. So thank you so much for asking that question. Absolutely. Yes, we appreciate you. So thank y'all so much again for being on tonight. We do this every Monday night. And so at 6 o'clock Central Standard Time. So whatever, wherever you're at, we would love to have you. Please invite people. We would love to help them answer questions. That's what we're here for, educate about the technology and really just answer questions and allow you to hear stories of people that have been helped as well that want to come on and share what's going on with them. So we pray blessing over each and every one of you tonight. And thank you again for being on the call.
Thank you, Nikki. God bless.
Good night, everyone. God bless.
God bless.